The goal of a midwife is to support women throughout their life. It's not just in pregnancy and childbirth. We see all populations of women through all stages of life. When I first went to nursing school, I thought that I wanted to go into pediatrics. That was kind of my goal from the get-go. And then when I did my OB rotation, I realized that my love was very much in women's health in the OB world and in labor and delivery. And so I switched my goals. I pushed myself to keep going and become a certified nurse midwife because I wanted to give the voice back to the women who were in the labor and delivery rooms. I feel like we often don't realize that we're talking over people when we're making recommendations. And instead of just giving the information and providing a choice, we say, hey, we need to keep going, so I'm going to do this now. Instead of saying, hey, we really need to keep your labor progressing. We have these options. Let's talk about them. Which one would you prefer? Which one aligns with your goals? And so I really wanted to make the next move so that I could provide that choice. So instead of me just saying, man, I really wish that they would have presented it different to the patient, I decided, well, why don't I become that person so I can give them that choice that they didn't necessarily have in that moment. In Midwife in Ohio, specifically in the hospitals, is a certified nurse midwife. So that means that we all start as a registered nurse. We are certified by the Board of Nursing. And then we go on to a graduate level of school. We get a master's degree. And then we also have to pass a boards for midwifery. And so I can care for any pregnant individual who is looking to birth in the hospital. Even if you're slightly preterm, as long as you're greater than 34 weeks, I can still take care of you. Even if you're having some medical complications along with your pregnancy, diabetes, high blood pressure, I can still care for you because I work with my collaborating physician as well. So I can see low risk and I can partner with my physician for the high risk as well. So you get a little bit of both. I think the biggest difference between a certified nurse midwife and a RN per se is I get to also catch the baby, which is the really fun part. So anybody who might be anxious or scared for when it comes to labor and childbirth, it's a very valid feeling. There's a lot of unknowns, especially if you've never experienced it before. You might not know what to expect. My best advice is ask your questions, even if you just have a broad question of what should I expect? And we can talk about, well, a normal labor course might look like this. Or if we have to go in for an induction, there's different ways that we might have to do that. So let's talk about those and what you might expect that way. Questions are very big to me, and I always encourage my patients to ask them because knowledge is power. And the more that you know, the more that you can anticipate and feel comfortable in what's going on around you. I've been with this organization now for 10 years. I've had 3 babies over at Christ Hospital Liberty Birthing Center, and all my births were super special. I knew that I was always in good hands, and I knew that they always had my back, and they had my interest and my baby's interest at heart. So that's why I really wanted to stay with Christ as a midwife. It's a really special place, and it holds a special place in my heart. And I love it dearly.